Hey everyone, and welcome to the PTCB Prep Guide. Today, we are diving into a topic you absolutely have to know for your exam: high-yield respiratory medications. We're going to break down all the essentials, from simple cold remedies to the crucial inhalers for asthma, so you can walk into that test feeling totally prepared.
All right, let's get right into it. We're going to focus on the must-know drugs, the ones you're most likely to see on the exam. We'll hit everything from the common cold to chronic conditions like asthma, making sure you nail the generic names, the brand names, and what they actually do.
So, here's our game plan. We'll kick things off with acute stuff, like colds and the flu. Then, we'll pivot to the long-term chronic diseases, COPD and asthma. And we'll wrap it all up with a final review to really make sure this information sticks. All right, first up, colds and bronchitis. You are going to see these medications constantly. Every single day in the pharmacy. They're a mix of over-the-counter and prescription drugs, so getting these down is absolutely essential. Okay, so someone comes in with a cold. What are we dealing with? This table breaks it all down. For pain and fever, you've got acetaminophen, which you probably know as Tylenol. For that plus inflammation, there's ibuprofen, brand names Advil or Motrin. Stuffy nose, that's where pseudoephedrine or Sudafed comes in. For that hacking cough, dextromethorphan, the DM and things like Robitussin, calms that reflex in your brain. And for sneezing and a runny nose, we've got diphenhydramine, which is just Benadryl.
So, what about bronchitis? This is a little different. It's not always just about managing symptoms. Sometimes we need to step it up and open up the airways more, and we might even need to bring in antibiotics to fight off a bacterial infection.
The approach here is a bit different. Check this out. To open up the airways and make breathing easier, there's Albuterol, which you'll see as Ventolin. Then there's guaifenesin, brand name Mucinex, which is all about thinning out mucus so you can actually cough it up and out. But if a doctor suspects a bacterial cause, then you'll see antibiotics, like amoxicillin clavuleto, you probably know it as Augmentin, or the very famous azithromycin, aka the Z-Pak.
All right, let's move on to the flu. Now, this is a big one. Unlike a regular cold, we actually have specific antiviral drugs that can fight the influenza virus itself. The catch? You've got to take them early for them to really make a difference. So how do we fight back against the flu? The most common one you'll see is oseltamivir, which is Tamiflu. It basically stops the virus from breaking out of one cell to infect another. Zanamivir, or Relenza, does the same thing, but it's an inhaler. And then there's a newer one, Xofluza, which works a bit differently. It stops the virus from making copies of itself in the first place.
Okay, so we've talked colds, bronchitis, the flu, but what happens when things get really serious, like with pneumonia? Well, that's when we call in the big guns, a more powerful lineup of antibiotics. And listen up, because for your PTCB, you have to know these pneumonia medications. These are major players, so let's make sure we're comfortable with them.
What's really cool here is that they all have different ways of attacking bacteria. You've got amoxicillin and ceftriaxone, which literally smash the bacteria's cell wall. Then azithromycin comes in and stops them from making the proteins they need to survive. Levofloxacin, or levaquin, messes with their DNA so they can't replicate. And then you have Zosyn. This one is a serious heavy hitter you'll see in hospitals that powerfully dismantles bacteria.
Okay, so everything we've talked about so far has been about short-term infections. But what about the conditions people live with every single day? Let's pivot now to the chronic diseases, COPD and asthma.
And this section is absolutely critical. We're talking about medications that people might be on for the rest of their lives. These drugs are all about management and improving quality of life day in and day out.
With COPD, the name of the game is long-term control. We want to prevent flare-ups. You'll see drugs like tiotropium, that's Spiriva, and salmeterol, brand name Sudafed. These are long-acting bronchodilators. They work for hours to keep those airways open. You'll also see combination inhalers like Advair, which pairs a steroid to reduce inflammation with one of those long-acting bronchodilators. It's all about prevention.
Now, let's talk asthma. There's some overlap with COPD for sure, but there is a huge distinction you have to know for your exam: the difference between a quick relief rescue inhaler and a long-term controller medication. This is a classic test question, so pay close attention.
Okay, this slide right here is pure gold for the PTCB. For a rescue inhaler, the #1 drug is Albuterol for immediate relief. Now, for daily controllers, you've got inhaled steroids like fluticasone or Flovent. There's also a pill montelukast, brand name Singulair. And then you have combo inhalers like Symbicort. For really severe cases, there are advanced drugs called biologics like omalizumab or Xolair. Whew! We have gone through a ton of medications, and I know it can feel like a lot, but the trick isn't to just memorize a giant list. The smart way to study is to group them into their classes. Let's connect all the dots right now.
Seriously, thinking this way is a game changer for your recall. Instead of trying to remember dozens of random names, think in categories. Ask yourself, okay, which ones are the antibiotics, or which ones are the long-acting bronchodilators? It makes it all so much more manageable for the test. And that's a wrap on the high-yield respiratory meds. You did a fantastic job getting through all that. You've seriously taken a big step toward crushing this section on your PTCB exam.
So what should you do now to make all this stick? Simple. First, review your notes. Second, if anything was a little fuzzy, just rewatch that part. And third, practice those drug names, generic and brand, every single day. Seriously, flashcards will be your absolute best friend.
And hey, if this was helpful for you, do me a quick favor and hit that like button and subscribe. It really helps the channel grow and lets us keep making more content like this to help everyone get ready for their exam.
All right, that's it for me. Keep up the amazing work. Stay confident. You are absolutely going to nail this. You've got this.